Backed by popular demand, as this is his third webinar in the hashtag Sketch with Mao series that Elsevier has had the pleasure of hosting, we're really lucky today to have with us the very talented Dr. Mao Fong Lim. Just a little bit about Mao before I hand over to him. Mao is an artist and a core psychiatry trainee based in Cambridgeshire, and he's got a really keen interest in the intersection between art and medicine. And as mentioned, he's previously collaborated with us here at Elsevier to create creative online spaces through the Sketch with Mao sessions. So without further ado, I'm going to hand over to Mao to start the session. Thank you, Mao.
Thanks, Debs. Can you guys see my video? It's a bit of various bits on it. Welcome everyone to another edition of Sketch with Mao. Thanks so much to Debs and Elsevier for having me. As Debs introduced me, I'm an artist and a core psychiatry trainee based in Cambridge and Peterborough. And today's session, for those of you who are new, really is about just sort of art and exploring neuroanatomy. It's not going to be a full-on neuroanatomy tutorial, but I can chat a bit about it. And it is a space where you can sort of just explore your artistic endeavors. If you're an artist or if you don't usually draw, just join in, why not? If you'd like to ask me about my experiences as a psychiatry trainee, as a doctor, or just want to talk about mental health, feel free to do that as well, and I can try and address any of your queries. But we will also be using something called complete anatomy to look at neuroanatomy, which actually really helps because it's all in 3D. If everyone has sort of pen and paper and whatever art materials that you guys want to use, get them ready because we're going to do a bit of a warm-up. So before the session, this is my third session, but still doing something like this makes me quite nervous, so I like to warm up first. So I just did a bit of sketch and watercolor. I really like watercolor for various reasons, and I'll show you exactly why I like watercolor and sort of what watercolor techniques I like using as well. But let's start with your blank piece of paper and a pen. Now, there are few things more scary in the world than a blank piece of paper or an empty Word document. And actually, starting anything is the hardest part of doing something. So let's just start with your pen and paper and really not doing anything much. But I want to invite you to just make marks on paper, whether you've got a few lines, or whether you're making some circular shapes. Just join me and spend a minute or so just focusing on making some marks, some shapes, and slowing down your thoughts and just focusing on this for a moment. Notice how as you are focusing on something, can start to clear your mind, and maybe you find yourself breathing a bit deeper, longer. Maybe because of the breathing, you notice your heart rate coming down. And you're just trying to focus on what kind of, not so much on what you are drawing, but just where your hand is on the paper. You're being aware of your hand connecting with the pen with the paper, the texture of the paper as you run your pen over it. And one of the reasons I really like art is because it's a space where you can make mistakes, and some artists would say there's no such thing as a mistake. Bob Ross will say it's all happy accidents. But really, this is not a session to be a perfectionist. Maybe you are a perfectionist, and that's okay. But I'm not perfect, and no one is. So be kind to yourself and just enjoy this time. So I hope your paper is now filled with marks, because that means you've now gotten started, and you can make mistakes, or you can make happy accidents, however you like to call it. And I want to introduce you to a bit of watercolor. I'm not sure how many of you guys have watercolor on hand at the moment, but watercolor is one of the favorite things I like to draw with, or paint with actually. And the reason is because it just feels so, it's very much in the moment. It's very difficult to, I guess, correct something that you paint in watercolor, compared to, say, oil painting, where you intentionally paint layer over layer over layer. Watercolor seems and feels a lot more in the moment, a lot more kind of light, I guess. And you can do quite a lot of interesting things with watercolor. And one of the favorite things I like to do is something called wet on wet, where you take just water. So I got a paintbrush which has just like a water reservoir in it, which is quite handy. So I can just take it around with me. And what you do is you just wet your paper with no color, and you get some paint, and you make it quite wet. You make the paint quite wet, and you just sort of paint onto your wet area of paper. And I'm not sure if you can see this through the video, but the paint really just leads into that area of paper. And in that way, it's quite unpredictable, and you get to see some very interesting effects come on through it. And sometimes I like to just sort of start with color instead of pen. And we'll let this dry and come back to it later, see what I think of doing with it. So continue drawing, continue doodling, but what I'm going to do in the meantime is open up Complete Anatomy for those of you who have access to it. If not, don't worry, you can see it on my screen down here. Let me know if it's not really working for you. So Complete Anatomy is, I found it quite handy, but it can be a bit difficult to find out where to get what you want. So what I've done for this session is I've gone through Atlas from the homepage, scroll down, try to look for this one, the lobes of the brain. Clicked on it, and you get this. But if you click X on library, you actually come to kind of like this setup or this mode where you can actually sort of cut away bits. So you see, if I right click, might not be able to see here, but I can hide this. Oh, and everything's back. So I'm going to bring this back because I don't want to cut the brain yet. Right. So let me take you through a sort of tour of the brain. And if you have any questions or anything at all, feel free to drop it in Q&A or the chat. I'm more likely to notice the Q&A than the chat. So how do we even get started with drawing the brain? Well, the brain is like a walnut. It's a walnut-shaped organ. It's arguably the most complex organ in our body. And it helps to appreciate the gross surface anatomy of the brain. You have your frontal lobe, your parietal lobe, in the middle, the temporal lobe, which runs by the side, and at the back, you have the occipital lobe. Below that, you have the pons, the cerebellum, and the brain stem down here, which goes all the way down to your spinal cord. So going back to our paper, you can start out by drawing a general outline of the brain. Sorry. And from there, I like to start with drawing the temporal lobe. So this is called the Sylvian fissure, which separates the, not completely, but the temporal lobe from everything else. You can then go with the sort of central sulcus, which separates the frontal and parietal lobes. Then you've got your occipital lobe somewhere here as well. Then if you go a bit below, you have your pons, you have your cerebellum, which is sticking out a bit. You can go on to your brainstem like this. So you've got the general structure of the brain, and then now the sulci. So some sulci are important. So sulci are the grooves in the brain, and the gyri are the sort of raised bits in the brain. And they all have their own sort of specific functions. But if we're just wanting to draw a brain for aesthetic purposes, you've got your outline of the brain, and really, if you look at it, most of it is just sort of a squiggly outline with folds here and there. So I like to actually be quite freehand about this. So yeah, I guess generally from afar that would look like a brain, and I'd be quite happy about that. But what if you want it to be a bit more freehand? So let's just experiment with drawing brain shapes. So at this point, I want to encourage you guys to just be creative as you want. You can throw the laws of neuroanatomy out the window, because actually no two brains really look completely similar. I happen to have an MRI scan of my brain, and it was not how I expected it to look like. So yes, everyone's brain is slightly different. Everyone has some form of anatomical variation. So just going to spend a bit of time drawing some brains, and going back to our sort of patch of watercolor here, you can see how it's dried in a very interesting way. You've got gradients of color. Let me try and zoom in on it so you can see a bit closer. So it's dried in a really nice way, and this is what I like about watercolor, that it's quite unpredictable, and every time you play with watercolor, you can end up with something different. So it's not the same every time. So I'm just going to draw a bit of a brain outline. Just be as creative as you want. This is called the brainstem after all. Maybe your brain is growing on a plant. maybe you've got some extra outlines around your brain. Just going to color this in as well. What am I feeling like? I think it's a good time to check in and see check in with yourself and see how you're feeling. Today I feel pretty good. I just finished a weekend on call, so I was quite busy, even in psychiatry. So I'm very happy to have the day off and spend it doing some art with you guys. And today the sun is actually shining outside for once, so that's actually really nice. And I do feel quite sunny today, so I'm going to go with a big sort of yellow outline. And this is one of the other things I guess I do with watercolor. I've put a thick layer of paint, a bit more concentrated, and you just go around on edges with your brush. And keep going round. You get this kind of sort of radiating halo effect, which is useful. Let's say you're painting a candle or light source or something. This is kind of how you would approach it. Maybe we can go with a bit of color inside the brain. There we go. Got one brain. So if it's okay with you guys, I might sort of chop the brain now. Whilst I talk a bit about my work at the moment. So I've just started my first job as a psychiatry trainee, and I work on an old age inpatient ward. So me and my team look after older adults who have functional mental illness, so things like depression, schizophrenia, psychosis, anxiety. And we also look after patients with what we call organic mental disorders. So these organic in the sense that, they come from a physical place, they come from, for instance, dementia or patients with brain damage, for instance. And I guess in the past 2 months, I've really learned a lot about dementia and learned a lot about working with and looking after people with dementia. And really is a very, very heartbreaking condition. It's progressive. From the onset, that the end point really is huge change in how someone is, and eventually this does lead to their death. It really affects families, friends, and it really does change the world around how someone is. And most of it, there are various types of dementias. You've got things like frontal temporal dementia, you've got Lewy body dementia, you've got vascular dementia, but the most common by far, at least in the UK, is something called Alzheimer's dementia, which many of you will have heard of, and maybe you have family members with Alzheimer's as well. And certainly my own grandfather had Alzheimer's, and back then as a kid, I didn't really understand much about dementia, but that did color my experience of what dementia is. And most of the time, we see a lot in Alzheimer's. You have what we call cortical atrophy, so the whole of the cortex atrophies or shrinks. So all these little ridges, they get deeper and deeper. All these, bumps and lumps, they get smaller and smaller. And most of all, you see the temporal lobe really, really shrink like this. And especially sort of the medial temporal lobe, which is this bit inside here. So what I'm going to do now is I'm just going to cut through the brain, as I mentioned. So I'm just going to click here, hopefully it works, and I will say hide. Oh, it's nice. So we get this cross-section of the brain over here. And just going to take you on a bit of a tour around some of the structures here. This is the ventricle. It's more of a sort of space where your CSF runs in. This is your corpus callosum, which connects the left and right sides of the brain. This all forms part of your basal ganglia, your caudate nucleus, your your putamen, your caudate nucleus. You've got your amygdala over here, which is sort of the fear response, and you've got your hippocampus over here, which is named after the fact that it looks like a seahorse. And sort of the other end of it is something called the mammillary body, which forms part of a memory circuit called the Papez circuit, and which is sort of the processing of memories, especially those related to sensation and smell as well. Interesting fact about the mammillary bodies is that it's affected in thiamine deficiency, and particularly in a condition called Wernicke-Korsakoff's disease, and that's due to sort of alcoholism and alcohol dependence. So in Wernicke-Korsakoff syndrome, you have anterograde amnesia, which means you can't form new memories at all because this little friend is damaged. So that's just more fun facts that I picked up from studying my exams. So I guess we can spend a bit of time drawing this view of the brain. And I sort of, whilst practicing just now, came up with this, and I was thinking about, the hippocampus and its role in forming short to long-term memory, and when it's damaged in dementia, really the memories kind of stop here. So I can go on and have a bit more of a go at drawing this view of the brain. So with this view, again, I start with the overall structure. Pons over here, cerebellum, brainstem. When you do a cross-section of the brain, you do notice this bit where, it sort of curves like this. You've got the corpus callosum connecting the two. Caudate nucleus, your putamen. You've got your hippocampus over here peeking out, amygdala, and your mammillary body as well. Then you just fill in the sulci. I guess if we're thinking about some dementia, I'm thinking about cortical atrophy, so shrinking of the brain, and this is how it might look like in the brain of someone with dementia. I've got a question from someone, anonymous, asking why I chose psychiatry. Well, I guess that's a really good question, and quite a number of reasons. I think psychiatry is a really wonderful field. Whilst we're talking about neuroanatomy here, whilst I'm talking about how your sort of medial temporal lobe atrophies and dementia, mental illness, and any of these, I guess, behavioral conditions, they are not just people are not just cells. People are not just your little neurons. People are not just dopamine and synapses and stuff like that. People are their impact in society. People are their relationships. People are the the things they do for the world. People are the joy they bring in other people, and that's why psychiatry is a field of medicine that really does not ignore that. Yes, I if you're interested in the brain, there's neurology, but I think psychiatry really is is to me the more engaging and interesting specialty. And I think as a medical student, as a doctor, ultimately we always talk about medicine as being a calling, but ultimately medicine is a job for us, and you have to find something that you enjoy doing, something that gives you enough joy to keep going as well. I like to think of fit. I like to think of psychiatry as being a really good fit for me. I'm someone who likes to speak to people. I am quite patient. I can listen to people for quite a long time. I like observing people's behavior. I consider myself quite observant. And I am creative, and I think psychiatry is the field of medicine that does welcome creativity, whether it's something like, I like using art in my practice, or whether it's creativity in the sense of like, well, why don't we come up with a creative solution to help someone in distress or help someone with overcome a difficult situation, or whether in psychotherapy where you really do have to think outside the box when it comes to helping others. So I guess that's why I chose psychiatry. I still have a love for procedures. I like working with my hands. I like drawing. But I think ultimately psychiatry is the best fit for me. And Sophie has asked if I feel that drawing helps me to become a better doctor. Does it take away stress? Yeah, it really does take away stress. I mean, this has been a really nice session, and I feel a bit more settled now. There's always a lot of anxiety before starting it. There's a lot of stress, but I think drawing helps you focus on one thing. It is a very mindful thing to do. And I think it does help me de-stress at the end of the day. It does help me process, I guess, thoughts and ideas of difficult things I've experienced during the day as well, for instance. And it does help me process and think through some, I guess, ideas in medicine, or wider ideas about psychiatry. So if you can see in the background, I've got a little drawing that I propped up there. This is a painting I did a few years ago, and it's a brain, but it is also, for those of you who are familiar with the geography, this is a map of London. This is the River Thames running through it. And this is trying to combine ideas of sort of epidemiology and epidemiology of mental illness and the map of London. And you can see some areas where I've done quite sort of dark spots here, which correspond with higher rates of mental illness and psychosis, and also social deprivation. And I guess with this piece, I was trying to explore, the links between mental health, the links between social deprivation, and actually how, even though we talk about, I guess, a troubled mind, there are still some beautiful spots as well. There are aspects of, someone is not defined by their depression, someone is not defined by their schizophrenia, and there's a lot to discover under the surface if we care to listen and ask them. So yes, I do think that drawing makes me a better doctor. And of course, when you meet, I guess, patients who are quite artistic, who are very creative, you kind of tune into that as well. And I think it just helps you connect with people. The same way that, if you're a sports person and you get to chat to people about football and you build rapport, that's your thing as well. So, you get to bring people into, you get to bring yourself into your work as a doctor. And I certainly bring that part of me as an artist as well. Debs has asked what I think about art therapy. I think art therapy is vital. I think there's not enough of it around, especially in the NHS, I think. I guess if you want to think about, formal art therapy, so that's someone who's been trained, who's had years of training in using art alongside some psychodynamic, psychotherapeutic thinking and principles. That is very, that's a profession in itself that's quite difficult to provide, I think, in limited funding, but I think it can be extremely beneficial to people. I think if we take it sort of one step below and think about art as therapy, even the simple act of providing art materials on a ward for patients, and this is not just in psychiatry but anywhere, being able to just like this, for instance, if occupational therapists or nurses or even doctors can sort of sit with patients and say, let's draw something, let's take your mind off your pain or your suffering, let's just take some time to just enjoy drawing and painting. I think that is a wonderful thing. And yeah, I think that's what I would like to do. I would like to be a doctor who can bring art into my practice and engage my patients with creative practices like this as well. I've got another question from an anonymous attendee. Why is neuroanatomy so hard? I don't know. It is really, really hard. And I don't consider myself proficient at neuroanatomy, which is why, I want to try and understand it. I want to try and learn it well. And I'm studying for my exams right now. So this helps. This, going through and trying to simplify neuroanatomy does help. I guess your follow-up question is then actually, how can we make it easy? Oh, I don't really know, but neuroanatomy is described in sort of circuits. You have to think about how this bit connects with this bit and how it relates to that bit. So maybe thinking about it as a circuit helps simplify things. I'm not sure, but certainly I think looking at it, in a 3D kind of way with something like complete anatomy, does really help, because, for instance, you learn about the, for instance, the basal ganglia, you always learn about it in sort of the cross section, but being able to see it like this, you kind of appreciate, okay, so these things are next to each other, they're kind of related in this sense. So I guess people have different ways of learning neuroanatomy, and actually some people, some groups, they do sort of Play-Doh models of the brain, and by building the brain from inside out and understanding how the brain develops and how the brain evolved, does help some people understand neuroanatomy. So I guess trying different ways to learn it would help. And we've got one more question about how to relieve stress. I think it's different for people. I think it is about doing what you enjoy. And it's about being able to take your mind off things. But I think things like, if we look at sort of stress or coping mechanisms in as a pyramid, I would say things like, yoga or making art or listening to music or cooking or gardening are up here. This is your sort of recreational stress relief. But really the basic, all your resilience training that certain companies or hospitals or medical schools will make you guys do. This is all up here, but the basic stuff down here is making sure that you're not discriminated against, making sure that you're not bullied at work or at university, making sure that you're well supported by your tutors, by your kind of your bosses, your supervisors at work. There are many layers to well-being, and it's not just about giving out vouchers for yoga classes or drawing. Really, you have to start from the basics, which is not giving people a terrible time at work, making sure people respect each other, and that people are well supported in dealing with difficult events, because medicine is tough. Medicine is a really, really tough job, and I think it's not solved by just yoga and mindfulness. I guess maybe approaching our last question, question from Tanner, who says that they find drawing and art quite frustrating at times because it doesn't come naturally. Is it worth trying to persevere drawing to assist learning, or are there some people it just doesn't work for? I would say, I think art is very loosely defined. This could be art, this can be art, this can be art, but I think for me, the creative process matters more. The act of creating something that gives me a lot of joy, whether in the end I like it or not. It's an exploration. So if you treat it like an exploration, if you expect to make mistakes, that does help with the process. It makes it less frustrating. But I think if your concern is the outcome, for instance, you're trying to draw a diagram of the brain for your own learning, I think that can be quite frustrating because you're trying to get things right, you're trying to make things perfect. And I guess I wouldn't say that some people just cannot draw. I think practice does make things better. Practice doesn't make perfect. Sometimes there is no perfect, but it does make things better. And I think it's about trying to experiment with different ways and find out what works for you. So yeah, I think just if you like it, if there's a strong reason for you to keep going with it, why not just keep trying? And I think they always say that the things that are worth doing in life are the difficult things. So yeah, keep persevering with it, but find what brings you joy and happiness, and what works well for you. So yes, thanks for joining in the session. I'm going to hand it back to Debs. Thank you all for your questions and interaction, and I hope you enjoyed today's little sketch session.
Thank you, Mo. That was amazing. I drew mine as well. I don't know if you can see, but it's a bit like a helmet.
Nice.
But I found it very relaxing, I have to say.
Must be a cyclist then.
Yeah, it was really nice. I had to stop myself from drawing just because I knew I had to concentrate. But that was great, and it was lovely that you showed complete anatomy, and really great that we had so many interesting questions about psychiatry and about neuroanatomy, and stress as well. And I think, yeah, thank you for all of your answers. They were great. So I really probably think it's time to let Mao go. I did ask you a question, actually. Would you mind posting the drawing that you've done, which I think is amazing, in our social channel, please? Or
sure, of course. I'll post it and
hashtag.
tag you guys. I'll post this whole kind of like
that would be amazing.
Yeah. Thanks everyone for joining. It's been a really fun session. Thank you all.
Thank you, Mao. And yes, I just wanted to thank everyone else who's been on the call. Thank you for joining. It's lovely to have you. Thank you for your questions. Hope to see you soon.
Bye.